Good afternoon, everyone, and welcome to today's webinar titled The Ultimate Guide to Choosing Your Healthcare Tech Stack for 2025. I'm thrilled to have you all here so that we can discuss this exciting topic to prepare for next year. By way of introduction, I am Steve Burnett. I will be your guide today. Now, before we begin, I understand that questions will arise during the webinar. However, to ensure all questions are answered promptly, we ask that you please either write down or remember your question for later. During the last few minutes or so of the webinar, we've set time aside specifically for Q&A. So let's get started. Today we'll cover how to gain a clear understanding of your revenue cycle's current performance and discover the tech stack features that can propel your success in 2025, such as how to assess and optimize revenue cycle, choosing your patient communication platform, streamlined payment collection solutions, leveraging automation tools to reduce administrative burden, and choosing the right technology stack. So how to assess and optimize your revenue cycle. Before attempting to bring your revenue cycle back to life, you must clearly understand its current state. To truly optimize your revenue cycle for 2025, you have to identify and address bottlenecks. Common bottlenecks include slow reimbursements, limited patient payment options, and billing errors. Manual data entry in healthcare is an open invitation for error. By proactively identifying and resolving these bottlenecks, you can streamline your cycle and ensure a more efficient and profitable operation for the future. Evaluate your current metrics. Observing your KPIs provide insights into your practice's financial health and operational efficiency. Some metrics to look for when reviewing your current revenue cycle include days in accounts receivable, or AR. This metric indicates the average number of days it takes to collect payment after a service is provided. A lower number is preferable, typically aiming for fewer than 40 days. And there's patient payment collection rate, the effectiveness in collecting patient balances at or before the time of service. High collection rates suggest good patient engagement and upfront payment practices. Of course, there's average reimbursement per patient visit. By calculating the average revenue received per patient visit, practices can assess if their reimbursement rates are consistent with expectations and identify any potential shortfalls. By regularly analyzing these metrics, a practice can gain a comprehensive understanding of its revenue cycle health, identify areas for improvement, and take action to optimize collections and reduce revenue cycle bottlenecks. Now that you've identified key metrics and bottlenecks in your practice, it's time to set SMART goals: specific, measurable, achievable, relevant, and time-bound. These goals should align with your practice's financial objectives and patient care priorities, creating a clear roadmap for success and a benchmark for tracking progress throughout 2025. Regularly review and adjust these goals to keep them relevant and achievable as your needs evolve. With your goals in place, you can begin exploring the right healthcare tech stack for 2025. Let's dive into the features that can optimize your practice's revenue cycle. Understanding bottlenecks and the right metrics to measure is the first step toward optimizing your revenue. Another key feature to improving your revenue cycle is how effectively you communicate patient financial responsibility to your patients. Equally important is how effectively you communicate patient financial responsibility. The choice of communication platforms plays a pivotal role, as clear and proactive billing communication can significantly enhance patient satisfaction and accelerate payment collection. After all, every patient has unique preferences for how they wish to receive communication from your practice. According to a survey conducted by Consumer Action, 74% of consumers want to receive paper statements, but the majority said they still prefer to pay their bills online. Even in the digital age, patients still prefer receiving their bills in the mail. It's that physical reminder that aligns with how many of us pay our bills each month. But that second part of the survey is equally important. The majority of patients want to pay their bills online. This highlights that mailed bills remain to be an essential communication tool, and offering online payment options through paper statements encourage faster payments. At BillFlash, our mailed bill services enables the best of both worlds. A professionally printed and mailed bill that is approved and sent via first-class USPS the next business day, which includes a QR code that enables convenient online payments. QR codes to online payment options make your mailed statements have even more value, driving faster payments. While some patients prefer traditional paper statements, others favor digital reminders like emails and texts. Text reminders in particular are almost certain to reach your patients. Including text reminders in your tech stack is crucial, as patients increasingly rely on their phones for communication and managing daily tasks. With 1 in 3 people checking their text within 1 minute of receiving them, and 85% of people checking within 1 to 5 minutes, you know that your bills are being seen, and being seen quickly. If you want to unlock the secret to faster patient payments to improve your revenue cycle, the key is fortifying your mailed statements with electronic billing that instantly lets your patients know that their bill is available to view and pay. In fact, industry data reflects sending electronic statements in addition to paper typically cuts the average days to payment from 20 to 9 and boosts the percentage of full payments rendered from 77% to 95%. This highlights the importance of combining traditional and digital methods for your patient communication platform. If you were unsure about adding digital notices before, let this be your sign that mailed statements and email notices sent via email and or text are the best team for getting you paid more and faster. With the global telehealth market on the rise in recent years, clarity in bills and effective use of technology are crucial for successfully collecting patient payments. According to a report from Technavio, the telehealth market is expected to increase in value by $368.7 billion between 2024 and 2028, representing a compound annual growth rate of 40%. Rising chronic disease rates worldwide and technological advances are driving the surge in virtual care adoption, leading to new telehealth services. However, as virtual care options become more widespread, the administrative challenges of telehealth billing also increase. Telehealth billing can also have higher administrative costs due to the required coding requirements, challenges faced when attempting to qualify virtual visit types for reimbursement and additional staff training. Moreover, straightforward in-office processes like collecting copays become complicated and confusing for patients during telehealth visits. These combined factors can negatively impact a practice's bottom line if not addressed in time. As the market expands to an estimated projected growth by 2028, adopting efficient billing strategies to add to your 2025 tech stack will be essential to capitalize on telehealth's financial benefits and scale your virtual care programs. By adopting modern billing communication like pre-visit billing, medical practices can reduce these risks and engage patients early in the financial process for their telehealth care. One of the simplest yet most impactful tactics in telehealth billing is pre-visit billing. This involves sending patients a text or email with a secure link that leads them to a payment portal. Through this, patients can see their expected costs through a clear and detailed invoice before their virtual appointment. Informing patients of charges in advance increases the likelihood that they will settle balances before the due date. Utilizing cloud-based billing software like BillFlash simplifies and automates the entire pre-visit payment process. Tools like BillFlash Pre-Bill help streamline that entire pre-visit billing process. It automatically generates and sends a simple link via text or email with the pre-visit charge based on scheduled visit data from a practice's booking platform or EHR system. Pre-bill is designed to be used before a bill is created or when no bill is needed. This helps limit manual tasks that involve producing individual pre-visit invoices. By facilitating prepayment, practices can shorten their overall billing to payment cycle, which help accelerate cash flow. Building on the benefits of proactive communication strategies like pre-visit billing and e-bill notices, automated reminders take it a step further by offering a comprehensive pre-collection approach that effectively manages receivables before they become overdue. By utilizing a seamless cadence of automated electronic reminders, this service motivates patients to settle their balances more quickly, providing practices with peace of mind by enabling a set it and forget it approach. With BillFlash automated reminders, you can specify custom reminder rules to automatically send up to 3 text and 3 email reminders each month until the balance is paid. This proactive approach not only accelerates payment collection, but also reduces the need for more intensive collection efforts, helping to maintain a healthy cash flow for your practice. We are excited to announce that NexTrust will be adding this service to our BillFlash suite of services. Adopting a multi-channel communication and billing approach to your tech stack is an excellent way to improve revenue and get paid faster by your patients. By utilizing both traditional methods and digital tools, you can effectively reach patients through their preferred channels. This strategy not only enhances communication, but also leverages the efficiency and security of modern technology to accelerate payment collection. Clear and effective patient communication is the foundation for a strong financial relationship. But to truly optimize revenue even further, it's essential to take the next step, improving payment collection. By integrating multiple payment collection solution options and offering patient financing, you can make the payment process smoother and more efficient for your patients, ultimately enhancing your practice's cash flow. Offering multi-channel payment solutions can accelerate the payment process and improve your revenue cycle, as patients value the convenience of having multiple ways to pay. It's important to know that each patient is different in how they handle payments, like how each patient has different communication preferences. Office entered payments that easily accept card, check, Apple Pay, Google Pay, over the phone, and mailed payments provide flexibility and convenience, meeting patients where they're more comfortable and helping ensure faster, more reliable collections for your practice. Including multiple office entered options to pay and a secure online pay portal to your tech stack will enable patients to pay faster. Including multiple office entered payment options and a secure online pay portal in your tech stack will enable patients to pay faster. Why? Because offering flexibility meets patients where they are, whether they prefer in-office transactions, paying online from the comfort of home, or using multiple payment options. This convenience reduces barriers to payment, increases satisfaction, and ensures faster revenue collection for your practice. BillFlash Pay offers staff-entered payment options for in-office or over-the-phone payments, along with a convenient online portal that lets patients view and pay their bills anytime, anywhere. This flexibility not only enhances the patient experience, but also reduces payment handling hassles and costs for your staff. Offering convenient ways for patients to manage their expenses easily while reducing administrative tasks for your practice is essential for your tech stack. Here are some key features of BillFlash Pay that provide just that: pre-bill, stored pay, plan pay, auto pay, and retail pay. Pre-bill is the ability to request a payment from within BillFlash via text message or email prior to a patient's visit or service. Stored pay allows you to conveniently store a patient's preferred payment method for pre-authorized future use. Plan pay, when needed, You can set up an automated payment plan to get paid in full over time on a mutually agreed upon schedule. With AutoPay, patients enjoy the convenience of having their bills paid automatically in full each time a new bill is sent. And with Retail Pay, you can accept cash payments or payments without an associated bill. With the average bill costing $600 across healthcare, the average American can't afford a $400 unexpected bill, and that complicates things. So this leads to fewer patients seeking care. Patients are either not paying or delaying payment, and then providers are failing to collect 30 to 50% of patient balances. So the best way to ensure patients pay on time is by effectively communicating their financial responsibility and offering payment options that align with their preferences. But what happens when cost is the obstacle standing in the way of timely payments? Did you know that 90% of patients actually plan to pay their bill in full if they are given the flexible payment options? And BillFlash FlexPay is the answer for bridging the gap between cost and accessible healthcare for patients. In today's healthcare landscape, offering flexible payment options is more than just a convenience. It's a necessity. Patient financing solutions are a must-have in your tech stack, enabling practices to provide affordable options that improve accessibility, boost revenue, and enhance patient satisfaction. Using BillFlash FlexPay allows patients to pay their bills in monthly installments while providers get paid upfront in full. Offering patient financing attracts more patients, leads to more referrals and repeat visits. It also increases case acceptance rates. Patients are more likely to move forward with treatments and procedures that have been recommended by their medical provider when they are presented and with affordable payment plans. It helps grow revenue. By improving case acceptance rates, practices can generate more revenue from procedures that may have been delayed or declined due to upfront costs. The average transaction value also increases when upfront costs are no longer a barrier. It helps improve collections. Instead of losing revenue from unpaid medical bills, FlexPay gets providers paid in full upfront with no bad debt recourse. And then also reduces administrative burden. Your staff no longer has to chase down past due payments. We'll handle all aspects of collecting monthly payments. BillFlash FlexPay is a win-win for your practice and patients. Benefits for patients include, first of all, a quick application. There's no more cumbersome paper applications. Our online application process is quick and easy. There is no hard credit check to apply. Patients can view their options without impacting their credit score. There's a 90% approval rate. Balances as low as $60 can be financed. There are no late fees, and every approved patient will have a 0% interest finance option. The benefits for providers. Firstly, providers get paid in full right away, with payments initiated by the next business day, ensuring a steady cash flow. There's no operational lift as BillFlash manages every aspect of collecting patient payments, and providers face no recourse for patient non-payment. FlexPay also helps attract more patients since cost of care and travel time together comprise more than 70% of a consumer's choice when selecting medical providers. Offering patient financing can differentiate providers and draw in new clients. Additionally, FlexPay aids in retaining existing patients. Why? By enabling them to say yes to recommended treatment plans and pursue care and elective procedures they might otherwise defer. By minimizing awkward conversations at the time of payment, FlexPay facilitates more positive interactions and speeds up the time to collect payments, enhancing overall patient satisfaction and operational efficiency. As we explored various payment collection solutions to drive faster patient payments, automation has been a consistent theme across the features we've discussed today, including patient communication tools, coding, and denial management. Leveraging automation is a game-changing strategy to consider for your medical practice's 2025 tech stack. By automating processes and embracing advanced tools, you can reduce administrative burdens, giving your staff more time to focus on patient care while enhancing efficiency. Ultimately, this approach leads to a more streamlined revenue cycle and improved financial outcomes for your practice. In the rapidly evolving healthcare landscape, staying ahead requires more than just skilled personnel. It demands the right technology and tools. Investing in advanced billing systems, automation, and software is essential for improving accuracy, ensuring compliance, and streamlining workflows. By automating repetitive tasks such as billing, payment reminders, and data entry, practices can streamline workflows, minimize errors, and accelerate revenue collection. Automation tools like BillFlash integrate seamlessly with existing systems, enabling efficient mailed bill processes, e-bill notices, pre-visit billing workflows, and multi-channel payment processing. These automated workflows not only save time and reduce errors, but also improve patient satisfaction and ensure steady, predictable revenue streams. Our goal at NexTrust is to streamline your billing processes, reduce administrative burdens, and enhance your financial efficiency with our innovative BillFlash solutions. The new services that we've rolled out were part of our summer splash, and they have the singular goal in mind to get you paid. To see how BillFlash can streamline your operations, you can schedule a demo today at BillFlash.com. I do want to thank you for joining us today, and again, definitely go to BillFlash.com to schedule a demo. And until next time, this is Steve Burnett, and have a great day.